Okay, welcome to the webinar on evidence searching using psychology and behavioral sciences collection on the EBSCOhost interface. So in this session, we'll demonstrate the use of the PICO framework in searching this database, which is available nationally as part of the core content for NHS England. If we have anyone who's not from within NHS England, and also for those who are watching this later on, they're welcome, of course, but we will be looking at this from the perspective of the current interface for the NHS. And in this session, you'll also learn how to create the strategy, apply wildcards, truncation, proximity operators, and set up search alerts to keep current with the latest research. So just to formally introduce myself, for those who've not met me before or watched one of my recordings, I'm Richard Crooks. I work with the EBSCO Customer Training Services team. I'm based in the East Midlands in England. I'm a senior customer training specialist supporting library services in the UK, so not just the NHS, of course, also the equivalent HSC in Ireland, and also the Nordics as well. So I'm a chartered librarian by background, now with EBSCO for more than 14 years, having previously worked in the NHS myself as a librarian and related roles in the past. So welcome to the session. In terms of the agenda, we will look at the search strategy using PICO on the EBSCOhost interface, the application of wildcards and truncation, the setup of alerts as well, key feature we're focused on today, and also directly where you can find more support information, more help information. So in terms of the actual training objectives, it is my expectation that by the end of the session, so within the hour, you'll be able to create a search strategy using the PICO framework. And I'm sure for most of you, this is second nature, as it were. You've been doing this for many years on different databases. But obviously, we're looking at this from the perspective of PBSC, Psychology, Behavioral Science Collection, and on the new EBSCOhost interface, which you would have switched to very recently. Also, you'll be able to apply, of course, wildcards and truncation search strings to enhance your search, and also be able to create search alerts, keep current with the literature, and find further help and support information on EBSCOhost databases. So if you're looking beyond this database, for example, Cinemedline, we have also additional information available through our support portal and related sites as well. So I hope that's what you expected from this session. I'm sure for a number of you, this is just a refresher to see where we are with the interface, etc., but from the perspective of this particular database. So before we get into the intricacies of searching, just to give you a reminder then, an overview of this particular database, PBSC. So you'll see here, it provides active full-text journals and magazines there's 315 currently available for this database, and you can see the majority of these are already peer-reviewed as well. And users from subscribing institutions can link to full text from citations within API PsycInfo as well, from 100 full-text journals available in this database. So if you also have a subscription to API PsycInfo, because it's on the if you're using it on EBSCOhost, it's the same platform, then those links will be transferable. So the links available full text from within PBSC would then be accessible through APA PsycInfo. Of course, this only is applicable to those who subscribe to both databases. And as I mentioned, PBSC is available nationally across NHS England library sites. So just to sum up some of the key titles that are available, these are active or current full-text journals, and there's no embargo for these titles, which means you can get access to the latest content full text. That includes International Journal of Mental Health, for example, Journal of Clinical Child and Adolescent Psychology. Some others there you might recognize as well, the Journal of Mental Health, Religion and Culture, Journal of Mental Health Counseling, of course, there, and also others here, including Psychology, Health and Medicine, Substance Use and Misuse Therapy Today, and also Psychology Today is also indexed in this database. Again, these are active full-text journals, so you get the access to the latest issue and also with no embargo. So that barrier where maybe 3 months, 12 months, etc., is removed. So again, for a psychologist, etc., for those working in mental health, when they access the resources in this database, when they come to any of these particular titles, they will still be able to access the full text content from the latest issue, as it were. So now we're going to move on to the PICO searching itself. So obviously, PICO is just one of a number of frameworks that you can use. Andrew Booth et al. At Shire in Sheffield identified 38 variants. So again, we have PICO, which is the Patient Population Intervention Comparison Outcomes, very popular clinical framework. But we also have PAO, which involves exposure as opposed to intervention. We have PICOT, which includes the time element, or it could be a type of study, such as a randomized controlled trial, with others like SPICE and SPIDER as well. So there are numerous frameworks that may, and any one of these may be more pertinent to the search that you're carrying out, but PICO is the one we're going to use as an example in terms of creating the search strategy. So I'd recommend checking that document because it does give you more detailed information about other possible frameworks that you may want to use. And some of these, of course, you may already be using. So in terms of the interface, there is a guided search app which is available. We may have time to look at that, we'll see. But PICO or PICOT is the framework that's cited here. And you can see here we've got the population elements. So it could be individual, it could be a group of patients. So what individual group are we interested in studying? The intervention is what is the intervention or treatment being considered? What other interventions are being considered? The comparison, that may not always apply, of course. What do we anticipate as an outcome? It could be pain relief, pain control, it could be quality of living, well-being, and so on. And also the T element here, as I mentioned in the previous slide, the time or type of study. So how long would it take to reach the desired outcome? Could be within a 6-month time frame, for example, and what types of studies are needed. So again, it could be a clinical trial, for example. Now, not all of these elements are needed, but you can see the screenshot here regarding the guided search app. So you've got the 3 elements there populated. So eating disorders relates to the population group specifically. So that's the underlying condition, if you like. Then you've got the intervention, cognitive behavioral therapy or CBT, compared to family-based therapy. And we'll be looking at a similar search when we go to the actual creation of the search strategy in this session. But just to show you that, when the PICO option is selected, as we'll see live, then you can populate that information in the appropriate boxes. So again, not all are required, although the population and the intervention element are mandatory. So you must populate data there, terms there to run the search. Now, in terms of truncation and wildcards, just to let you know, again, a reminder, and this is almost identical, you could say, to Medline and Cinna on EBSCOhost. You have the truncation symbol, the asterisk, which can be used either at the end of a term or between terms. So if you're looking for bulimic and bulimia, then you can insert the asterisk after the I without the A, of course. That'll find both variations. If you insert the asterisk, the truncation symbol, between cognitive therapy, then you'll find cognitive therapy and cognitive behavior therapy and cognitive behavioral therapy. Okay, so expand your search. And then for exact phrase searching, always use quotation marks, double quotation marks. So if you look at anorexia nervosa and you enclose that with quotation marks, then you are searching for the exact phrase. And that means you'll find records where at least there is one occurrence of that reference to that phrase, as it were. Now, just a caveat to that as well, that when you are searching for phrases in this manner, you will notice that the key terms are also highlighted in bold where they are not necessarily together. So you will see anorexia highlighted, for example. Don't be put off by that. You should still be retrieving records where at least there's at least one occurrence of that exact phrase. And you can see there's a link there for more information on searching with wildcards. In terms of proximity or precision searching, we have the near and within operators. Again, you may be familiar with this in using Cinna or Medline and EBSCOhost. So near finds words if they are within a specified word range or less of one another, regardless of the order in which they appear or are entered. So eating and 5 disorders means you'll find the term eating near 5 words or less of disorders, and disorders near 5 words or less of eating. Within finds the words if they are within a specified word range, again, or less of one another, and this time in the order in which you enter them. So if you put family W2 therapy, it finds family within 2 words or less of therapy, but not therapy within 2 words or less of family. So note the number is actually literal. Some platforms, for example, when they used ADJ, if they had ADJ2, it means 1 word or less. Likewise, ADJ adjacency 5 will be 4 words or less, so not literal. Multiple terms can be used on either side of the operator. So, for example, if you're looking at the impact of exercise or physical activity with depression, then in parentheses you've got exercise or physical activity, which is also quotation marks, and for depressed. Depressed is truncated, so that's depressed, depression, depressed, etc. So it could be that exercise in relation to depression, or it could be a depressive who has exercise, etc. So again, these options are merely to expand the search to find what you're looking for, essentially, as opposed to just using a basic expression or a single term like depression instead of depressive or depressed. using truncation, the example there. We have a research question for this particular webinar, so you can see that on screen now. So in adolescents with eating disorders, how does cognitive behavior therapy, or CBT, compare to family-based therapy, FBT, in improving eating disorder symptoms? So you can see here, I've highlighted the key elements. Again, you can see almost immediately how they would relate to the PICO framework. We've got the population group eating adolescents, particularly, so there's an age group, but they also have the underlying condition of eating disorders. Then we've got an intervention, cognitive behavioral therapy, or CBT, a comparison with family-based therapy. And of course, the goal, the outcome here is to improve eating disorder symptoms. So again, I've highlighted in bold the key elements of this search. And you can see here, I've sort of fleshed this out more with details. So we've got the 4 elements which I've just mentioned, and the second row there indicates the keywords or the free text terms that we should be looking at when searching. So at this stage, we're trying to consider what terms are commonly used in literature by authors, researchers, editors, clinicians, etc., in terms of the population. So of course, we've got young people, teenage youth there, but we've also got eating disorders, anorexia, bulimia, binge eating, and so on. Likewise, with the intervention, we are looking at cognitive behavioral therapy, or CBT, so it could be the acronym. It could be cognitive behavior therapy, or simply cognitive therapy. So again, variations, derivatives of the term. We also have the comparison, family-based therapy, always known as FBT, or it could be family therapy, which I've not listed here. And then we've got the outcome. We're not searching specifically for the outcome. Obviously, with these interventions and the comparison, we are looking at improving those symptoms. And then the population for the third row in uppercase relate to the actual subject terms. So eating disorders, not surprisingly, would be a specific subject heading. Obviously, if you're looking in Medline, it would be a mesh term. Instead, it would be a center heading, anorexia nervosa, bulimia, and so on. And also for intervention, cognitive therapy, cognitive psychology is another term we could be using. For the comparison, it may be that family-based therapy is rendered in another way, for example, family psychotherapy. So that is an index term. Now, of course, you don't know from the outset necessarily what those index terms are. You will typically explore the database to look for those and then combine with the keyword searching. So what we do now, we have spent the majority of time on the live demonstration. So I'm now going to switch to my desktop, and in a moment you should see the EBSCO interface. And I've signed in as a NHS England user. I have an NHS Athens account for NHS England. So what you're seeing is more or less what you would see for your local site. I'm using a national account here, but obviously, in principle, what you'll find is related to yours, and the look and feel, of course, will be the same. So just to point out a few things, especially in the wake of recent changes, we have now the top navigation. So previously it was on the left-hand panel. It's now above. So new search takes you to this page, the default landing page, which is the advanced search page, of course. The browse by feature allows you to click through to the publications, and you can browse those. So I just do a quick search one here, for example. Psychology Today, you can see it brings up the link to the journal publication there. Also, in addition, we've got subjects here, so that takes you to the subject headings here, and you can see they're listed below alphabetically, and of course you can browse for terms here as well. So for example, if I put in psychosis, you can see psychosis rendered psychosis. So again, there's the browse by feature there. We've also got the research tools as well. So research tools just gives you a link to Publications AZ currently, which is the publication finder service provided by EBSCO, which you can also access through the Knowledge and Library Hub. So just to show that's linked there. And then we have essential links, which allow you to go to various sites, or the help menu here as well, which takes you to EBSCO Connect for the quick start guide. So again, for those who are new to the new interface, obviously it was you switched to it a couple of weeks ago. It's now here, so all the support information for using the new interface, searching and browsing, using a dashboard, etc., is now detailed on this page. Okay. And just to explore further, you can see now you can jump specifically to databases like CENAL, for example. So I'm signing currently with Open Athens accounts. That takes me now to this platform, this interface for CENAL. Okay, so just a reminder then of what's changed recently with the navigation here. And we do have the language selector too, by the way. So if you have colleagues, you know, healthcare professionals that you work with who want to review or use the interface in a native language, you see a choice of languages here, and you can change the language of the interface accordingly. Okay, and I'm signed in. This is my EBSCO area, which gives you access to my projects folder, which is the custom folders now for the EBSCO as it stands, as it is now. The save folder, so anything you save by default is saved here. Recent activities recording your use of this EBSCO database. And then there's the alerts feature, which we'll come to toward the end of the session as well. So I'm signed in as a user because you've got EBSCO single sign-on within NHS England, which means that when you authenticate to the database, as I did, you will then be signed in automatically to a personal folder, in which case you will not see my EBSCO on the top right. You'll see your name or something else here, depending on how it's been set up for you. So right now we are going to begin running this search. So I'm going to prepare to enter my terms here. So we'll begin with a keyword search, and I will factor in some of the elements I introduced you to in this PowerPoint earlier. So we're going to start with adolescents. Of course, this is the age group they're looking at, or the population group. And I'm going to truncate because there are variations of that, adolescent or adolescents, etc. And I'm also going to now add teen and truncate. That could be teenage, teens, teenagers, etc. I will also now add this one as well. So I'm going to put in here youth, and I'll put in young or person or people for young people. Okay, so I've used obviously truncation, adolescents. I've also got these parenthetical statements as well. So I'm looking, it could be young person or young people, and I'll search using the title or abstract field as well. And you can see that option you can select from the drop down menu. So once I'm satisfied with that query, I can click search, and in a moment you should see that pop up on the screen, and also the search history will be available as well to explore what we've done so far. Now, by default, you can see here, we've got set one with the search string. It's the title abstract search XB. Search options are displayed, by the way. These are overridden by the use of the field code. So that says phrase search. We're bypassing that as it were. But if you're doing unqualified search, if you didn't select XB, then the phrase here would mean the words are searched if they are next to each other. So that's been reconfigured for NHS England. And applicable subjects is the concept mapping, which maps the keyword search term to the appropriate term, which in turn is then mapped to the appropriate index term. But again, these have been superseded by using XB. You can see the hit result there. You've got the pancake icon there, which gives us the indication that we're using PBSC, and also the save ribbon, so you can save into the line of a search if you need to. That will be saved to the save folder. And then there's the compatible tools menu, which allows you to edit the search details, add to a project, or delete. We'll say more about those as we go through the session. So we've covered the first keyword search. We're going to combine that with the equivalent subject search. So for that, we'll go to Browse By, click Subjects. I'll just clear this, and then browse the source. So we're looking at adolescents. So I'm going to browse. I don't know exactly what the definitive term is. So I'll click adolescents here. And you'll see in this database, it's prompting us to use teenagers. So if I click on the term teenagers, you'll see it gives us a scope note. So essentially it's for someone aged 13 to 18. And you can see it's used for adolescents here as well, young adults also. Now we've got the main term here. And if I select the main term with the explode feature on, it also includes the narrow terms as well. So any of these, black teenagers, cell phones and teenagers, Christian teenagers, exceptional teenagers, all these are included here. Okay, this age group. If I scroll down further, there are related terms which could also be useful in terms of exploring our search further. So we've got AIDS and adolescents in general, as psychology, church work teenagers maybe. If we're in the US, perhaps teenagers, or North America would include that as well. High school students, possibly. Some of these are very specific, of course. I wouldn't use all these for now. So again, some of these relate to other subjects, but again, we may pick up some other elements here which could be useful and adults. And some of these are going to be included, I think, in the other areas as well. So let me just see how we are for this. Yeah, some of these may be included already. So again, for the sake of time, we're not going to include all of these, but I think that the lion's share we've picked up in this menu. So I'm going to just jump to the top here. This is really to illustrate. And again, it could be the first iteration of search. So you can see here, it's populated the search box with the appropriate subheadings. And you can see each of these is prefixed with DE or descriptor, meaning it's an exact subheading or subheading that relates to this database. Okay, so these are not keyword searches. These are subject searches. And if I click now search, it will run that search and retrieve records that have been assigned those headings. Okay, so that will pop up again in the search history below, above the search results, and you can see S2 here. So you've got these two sets here, and we'll kind of combine them together. So S1, S2, and we use the OR, combine with OR option, the button there, and then you can see that's entered in the top search box, and we can click search to group that group together. So we're looking at the age group specifically here, whether the age, teenage adults mentioned in the title article field or as part of the indexing. But of course, we're not just looking at the age group, we're looking at age group which has the underlying condition of eating disorders. So we're going to now search for that element too. So what we'll do here, we'll then follow the same process. We'll do a keyword search, and then we'll do the alternative. So I'm going to do eating disorders. I'm also going to truncate here as well, because it could be eating disorders or disordered eating. So N2, again, the precision operator near 2 words or less. So words can be found in any order. I'll also add anorexia and truncate that. So that'll be anorexia or anorexic. Okay, and also bulimia. So I'm just going to put it like this: bulimia, bulimic, and purge. Okay, so it can be purging or vomiting. And also, I'll add another search string here. So it could be example or binge, or still undo in parentheses, of course, as you can see, binge or eating or drinking. Okay, and that, yeah, another quick parentheses there. So again, we're searching for the keywords in relation to these phrases, these search terms which have been truncated, and I am going to choose title article again and search. So again, as I mentioned, there are ways to edit search strings, and of course, if anyone's got any further advice, then I'm open to suggestions, as it were. Mainly here is to illustrate what you do with the interface, of course, when you're searching, and of course, this could be the first iteration, so you may want to adjust it and change for later. Okay, so let me now do the equivalent subject search. So what I'm going to do here now is go back to my subject index, explore these headings. So we're looking for eating disorders. So not surprisingly, there is a heading, eating disorders, and you saw that in the PowerPoint earlier. So if I select this term and click explode, you'll see it's also included the narrow terms, which of course includes anorexia, binge eating, bulimia, and so on. And there's others here we may want to consider or be more specific there or broader. But I think what we do now is just select those ones. So again, the scope note is there, and what it's used for is also included here. So just jump to the top, add to the search. Again, the search terms, the index terms are listed in the top search box, and we can click search and retrieve records that have been assigned or indexed with those terms. And any comments, questions, please put in the Teams chat. We'll try and follow up towards the end of the session. So we've got those two terms. So I can combine S4, S5 together, and then combine with OR. Okay, and we should end up with S6. Okay. Okay, so I've run this previously, by the way, so I'm noticing the difference between previous searching, so I might need to make some changes to this, but we've got now the need to combine these search terms. So we want to combine the adolescents with eating disorders as one group. So you'll notice in the search history it's displayed in reverse chronological order. So just click the ID option above and it will resort for you. So again, we can combine the two sets together, S3, S6, and then use and, combine with and search. So that really is the first element of PICO, the patient or population group. We're now going to look at the intervention, which, as you might guess, is cognitive therapy or related terms. So we get on, just going to compare the results so far, what we've got so far for this. Okay. Again, let's see. We're now looking at cognitive therapy. So for this, I'll put in cognitive. Asterisk therapy. So that'll be cognitive therapy, cognitive therapist, cognitive behavior therapy, cognitive behavior therapist, and cognitive behavioral therapy or therapists, therapies, etc. So I also truncate that as well. Okay, and or CBT. Okay, so we use those two terms, as it were. Use title abstract here, and click search. So that's the keyword search for the intervention, and that will also be displayed below in a moment. So you can see there. Okay, and then we will then explore the equivalent subject term. Again, browse by subjects, clear the screen, and then cognitive therapy. So I just do cognitive therapy for now. Okay, and you can see a number of different therapies out that can be included. So what I'll do here, I will click on the lead term there. You can see the scope note, and you can see that this is used for CBT. So cognitive behavior therapy, etc., and so on. Cognitive behavioral therapy as well. So again, this is the right term to use. We click the main term with the explode option on. Narrow terms are automatically selected, and we might want to include the related term cognitive psychology as well. Jump to the top of the screen, click add to search. The terms are entered in the search box, and we can run the search for those index terms. So now, of course, we'll combine the two together. So we've got in the search history now S8 and 9. So S8, S9, group together with OR, and click search. Now, of course, we have a comparison according to this research question, which is family-based therapy. So we now start looking for that term. So again, we're going to look at this term, and we'll start with the family-based elements. So we look at family, could be family therapy or family-based therapy. So what we do is add the truncation. So it could be family-based therapy, family-based therapist, or family therapy, or family therapist, etc. It could be FBT, or it could be family counseling or counseling. So again, it could be family-based counseling or just family counseling. So again, it could be an alternative expression. So if we run the search for these terms, okay, then search here. And then the next thing, of course, we'll do will be find the equivalent subject term. So I'm just waiting for this to load, and it should do, and it's there, S11, it's on the left. Okay, so next we'll find the equivalent. Again, this is the comparison, and this is the subject element for this framework. And then I will put in family. Now, I could search family-based therapy and see what comes up. There are different ones here. We have got family psychotherapy here, of course. So again, you can choose, or you can simply search for family therapy, and you'll see use family psychotherapy. So these are related. Of course, this is the main term. Again, this is the description. If you're unsure about this, just check this term, and you can see it's used for family, group therapy, etc. So again, we select the main term. The narrow terms are selected, so that includes ecological family therapy. Let's see. others there. And there are related terms here. So we've got family therapist, for example, that we could use. So again, we can select that term as well, jump to the top of the page, click out the search. Again, those subject terms are listed. And when we run the search, we'll retrieve records indexed or assigned those headings. So we've got the third element completed. Okay, we weren't going to search specifically for outcomes. So we are focusing on the patient population group, the intervention and comparison. And we'll combine the two S11 and S12 together in one set, combine with OR, and click search. Now, what I might do here at this stage, I know when I ran the search earlier, I found a few more records. So what I'm going to do, I'm going to actually update one of the search strings. So I'm just going to click ID just to resort these. And again, you can see we've got that other set grouped together as well. So what I might do here is just double check some of the things I've been running to see the results I'm getting. Okay. Just going to check this. So particularly for the eating disorders, I know I obtained more results than before. So what I might do here is just make a slight change to this, because I know I did end up with more results than before. So I've got eating and eating disorders, or anorexia, or bulimia. Now I put in the I here, so I'm not sure that would make a big difference. But if you want to edit any search string, you can just go to the tools menu, click edit search details, click edit search, and then you can go in. For example, I can put in the I here, still bulimia or bulimic, and just see if that makes a difference. I know that was what I did originally when I ran the search. Okay, so I'm going to just update this. I'm just intrigued if this does make a big difference. And I might have also seen that maybe I didn't apply the typographic search to it. So I'm going to just run the search. I think I ran around the search previously. I didn't run XB as a search. So I think that may have changed. So again, you might have the view that it's better to do an unqualified field search than it is a typographic search. I know there are some instances that is the case. So I'm just going to remove that. I don't think it's going to make much difference, to be honest. So yeah, it doesn't make any difference. So I think the main thing that I found, I did an unqualified search for this search string really, which I didn't intend to do, but I did bring up more results. Again, you would review this to see, it may be you'll find more if you do a general unqualified search as opposed to typographic search. In any case, what we'll do now is combine the search strings that we have. So we are looking at combining S7. That relates to the P element of PICO, the teenagers, etc., with eating disorders. The intervention, S10, cognitive therapy, and so on, and then family-based therapy or family therapy, S13, and we'll combine them with AND. So once we select that, you can see the search string is detailed in the top search box, and then we can run the search for that. So interesting to see what I retrieve. I know what I've got originally around the search. I reran this recently, and I'm intrigued to see if the results are similar. Again, you have different iterations of the searches. And yes, I've got more or less what I looked for, what I was looking for. So I've got 44 references in total. Okay, we may be happy with that. We may want to limit it further. So we want to think too old. So we may just decide on the left-hand column to go to publication date. So notice that the filters are now on the left. So this is the NHS setup. So if you work outside the NHS, you may still see the filters coming out on the right side of the screen. Now it's been decided, it's been agreed centrally within the NHS in England to have the filters displayed on the left. So I can select publication date here, select past 10 years. And if I scroll down, I can also choose the language. So we go for English only in this case, and then apply these two filters. Once you apply the filters, you'll see that they're included in the search history. So you can now see Set 15, S15 is the combined search string with those filters applied, as you can see here. So we've got the number, 26 references. We've got the icon indicating that this is, we're still searching within psychology and behavioral sciences collection. The save ribbon's there. If you want to save this result set, you can do that. And the tools menu is there to make any changes to this, add to a project, or delete if needed. So that's our search history. And of course, the next thing would be to identify records that are particularly relevant. So we can look at this list. You'll notice now by default, the abstract is displaying. So that's been agreed at a national level. So again, it can be hidden, but typically speaking now, whenever abstracts are available, they'll be displayed as open. You can see the search terms that I've used are highlighted. So in yellow in the title and also in bold in the abstract and also in the subject fields, and click on show more to see more subjects that are listed. So these may give clues to additional content or for additional searching in the near future as well. So you can see I've got some articles that are relevant, and if I scroll down further, you'll see this one particularly, item 4, is especially relevant. We've got family therapy and cognitive behavioral therapy for eating disorders in children, adolescents, etc. And this is a set review and meta-analysis, and a fairly recent publication, just over a year old, March 2025. So again, this is the kind of thing that we're looking for. We may want to explore that further. We may click through to the article, etc. And we can check this out in a bit more detail. Okay, you see the abstract there in full. You've got the article below as well. So again, you can access the full text article. So for example, we go to the PDF from here or from the result list directly and explore that. And a key feature now of this updated interface, if you like, the new interface, is that we now have this menu to listen. So you can download the MP3 to listen to this offline or read it online, as it were. We have accessibility support here. So if someone cannot, if PDF is not suitable for someone, then they can request this available in Word or HTML. Okay, and there's typically a 3 to 5 time frame to receive this article in that format. So other formats are available to support accessibility as needed. Now, you'll notice a new feature here, which I've not shown anyone yet in a session because this has recently been launched and being beta tested, as it were. You'll see this feature, AI Ask Beta. And if I just click on that, this will allow you to interrogate the document using AI, essentially. So for example, you can summarize this document. So if I click that option, it's now analyzing the document itself. It's giving the main topic, the key points, why it matters, etc. And of course, you can copy this information. You can like or dislike, etc. So you can check what is the methodology. Okay. And you see information. And notice this is auto documented. So for example, where did it get this information from? Obviously, AI has been used to interrogate this document specifically. It's not going to the open web. And if you click on the little number note there, you'll see it's highlighted. So you see the sections where this information has been retrieved. Okay, so it's clear, it's explicit where it's found that information. So if you need to double check that, you can. Of course, you may want to read the article in any case, but that information is there. And you can ask other information, for example, okay. And you can see here. So this rates the research carried out by those based in Norway, the Nordics, essentially, Sweden as well. Okay, again, these are documented. Okay, it's, obviously in some instances, it's quite easy to check the information yourself. There is a feedback option here too. You can submit, comments here, etc. Again, I've just mentioned I'm using a NHS England account, so a central account, as it were. I'm assuming that you may also see this when you sign into PBSC, Sino, etc. But again, you'll see that now shown. Okay, so AI Ask is there available for users to ask questions of certain documentation, etc. within the interface. And of course, you can see you've got the various tools to save this item, the cite tool here to copy the citation and hybrid referencing. So that's the default format here. You can choose others if necessary. For example, APA is here as well. and you copy that to the clipboard. We have the export citation. You can copy this, for RIS, RefWorks, or sorry, export in RefWorks EndNote RIS format as well. And also you've got the option to add to a project. So a project is a custom folder. So we'll say more about that in a moment, time permitting. The share option allows you to share this document, this article, via Google Drive, OneDrive, or you can create a link to it if you need to copy that and paste that somewhere. And then the email option now has been expanded to include choices such as the detailed citation, which is by default where you can specify the fields you want to include and remove any that you don't want to include, etc., and send it accordingly. You can still opt to go for the citation style, Harvard, for example, or brief format, and then include the abstract along with it. You can also download the article, so you can download the full text in PDF or online if preferred, or simply metadata as well. And we've got Word supported. Okay, and then there's also the publication contents if you want to explore other articles in the same journal, as it were. So it's just, again, a reminder of the PDF content here. If we go to results list and scroll down, and you can hide the search history, by the way. Let's just go to the top again. You can hide it here. Okay, and then if you want to look at the online full text, that's also available here. And a couple of things to know about the online. You've got the translation option, so you can translate from English to another language or vice versa, etc. So if I put it in Danish, so if I'm a native Danish speaker, then I can change it accordingly. And it's machine translation, as you know, with the disclaimer above. And then you can also revert to the original language as needed. And the text-to-speech software is also there as well. So again, and there you've got the choice of word color. You can still download the MP3 here as well. There's also the content as well. So whenever you have HTML references, you can jump to various sections within the article itself as well. Okay, so again, if you prefer the online full text, in some instances, both PDF and HTML are available. And again, you have the option to request Word format if appropriate to the user, etc. We're just going to come back here. Okay. Okay, so I come to the questions before we finish. So again, just highlighting some elements there. There's also another feature here, more like this. So if you come to this one, for example, particularly this article, which is the one below, sorry, then more like this. If I come here, it will give you other references which may be of interest. So up to 5. Again, you can see this one as well. Would be certainly very of interest here. You can see more details there. You can view the content. You can go into the full text. Notice you've got the libkey link resolver 2 here as well, and the linked browsing also, which is available nationally in the NHS. And then you can review other articles. Now, for each of these articles, you can save them using the save ribbon or the bookmark icon, so they can be saved to your save folder as well. And you can also comment if you found the recommendation helpful or otherwise, and you can see the information about the recommendation. So it's exploring related research with EBSCO's unique metadata. Okay, so just to point that out to you. Again, the AI Ask option is available for this article, as you can see, and also for others where appropriate as well. Okay, so let's see. Obviously, if you're looking to save references, we've only got 26 references here, so you can select these. So typically in the past, you would select up to 50. You now can select up to 500. Of course, we've only got 26 in any case, so this would suffice. But if you were to select this and choose 500, you would, and because you've got EBSCO single sign-on, you're automatically signed in. So for example, if I had more than 400 references, then I can download that range 1 to 500. Of course, got 1 to 26 here, and choose the appropriate format here as well. So download it. Likewise, if I'm to save these, I can also save up to 500 in one click now. So it does require being signed into an EBSCO account. Obviously, it doesn't really impact those of you working in NHS in England because you've got EBSCO single sign-on. So when you authenticate again to the database, you'll be signed in automatically. So this will be visible all the time, as it were. But it means now you can, supersede that up to 50 per page type of thing and go beyond the page view, which is up to 50, and save up to 500 in one click, as it were. So again, that will work. And of course, if it's 1500, then you have 500, blocks of 500 references to save, etc. Likewise, with the add to project feature, you can see also it does give you this option as well. Okay, so just to highlight that option, and also for sharing via email, again, still up to 500 potentially. And also for the direct export, you can do a direct export up to 500 records from the result list now using this feature as well. So again, risk format is there. Now, just to add to that as well, the exporting of up to 25,000 records is still available for larger quantities of data. Okay, so it's still there, but in terms of saving or downloading, saving, adding to project, sharing, citing, and also exporting directly, it's now 500. Okay, so that's enhancement. So if I wanted just to do the initial set, as it were, the 50, then I can do that here. So if I select save here, then they'll be saved to my save folder. And if I go to my save folder on the top right, you'll see the references should be listed there. Okay, so now listed. Okay, I didn't say, yeah, the reason for 35 is I've got others that were saved for a previous session. Okay, so I say 26, there's another 9 that were there. I'd say previously, by the way. Notice the links are still available for these references as well. And of course, you can go through this list. You can unsave as well. You can select and unsave. Options to download, add to project are still there as well. If I go back here, okay. So that's saving the records, downloading, etc. Obviously, you can do that for each record as well. By the way, you've got the option to use the tools menu to cite, add to project, share, download, etc., and so on. As you can see there. In terms of the projects, just to let you know that if you prefer, you can save them direct to a project. So a project is available within the EBSCO area. So these are projects I have previously created. So these you may recognize from previous sessions. Okay, so these contain searches. For example, if I go into this one, it contains records that I've saved. And also, so it's just loading those. I may have got a lot of those. Yeah, I've got 50 records from a previous session, and also searches as well. So searches are stored here as well. So projects are custom folders. Again, you can either go into the project and create a new one. For example, this one here. So I can, for example, call it PBSC search, CVT, and FBT. So I can create this project. It's there now. I go back to my results. I can then select these records, add to a project, and select the project here, and add now. And then you get confirmation on screen that's been added. Go to my projects folder. Click on this link, and you see those references have been stored here. So again, the point of this is that you can save direct to a project as opposed to saving to the save folder where they're added to other previously saved records. Okay, so before I go any further, I just want to mention the alerts feature as well. So let me just come out of here. And obviously we've run a search. You may want to save that search. And of course, if you go to search history, you can do that here. Again, you can select the search. I can resort if you like, and I can download it, which I won't go through the steps for that. I do show in other sessions, but you've got a choice of formats here, PDF, Word, and so on. CSV is probably the best one for yourselves, as it gives you a table that you can edit in Excel. We've got also the Add to Project icon here, so I can add this search to a project. Again, the one I just created. Click Add Now. And if I go back to the project, you'll see it is listed here. So not only do I have the articles saved, those 50 references in the Records tab, but I also now have the search here given. So all 15 sets. Okay, so again, I can review that if I need to. I can also delete if I no longer need that as well, by the way. But importantly, so you can delete search sets, by the way, as well. Go in and delete these. So for example, this one here, I can go in and delete it. Remove that one. Okay, and if I was to create, let's see, I'll come back to search history in a moment, but if I wanted to create the search alert, then what I would do is go to the results set, the results here, select the tools menu and create the alert here. Now it defaults to the query string, so I'm going to remove that and then just call it the CBT and FBT equals orders in our lessons. Okay, I should add PBSC so I know what this is about. I can add a description. The daily alert can be daily or it could be weekly or monthly. I'll go for weekly here. You can see it's created. It will continue for up to 1 year unless you delete it. You see the query string below and then your email address where it's going to and the database, of course. I create the alert here. So click close. I think, well, now where is that? As you may recall, if I go to my personal user account, you'll see alerts here and it's stored under search alerts. Okay. Those include the 2 filters as well, which is the publication date for past 10 years and English language. And then if I go into the tools menu, I can view the results. I can generate an RSS feed if I need to. And then there's the option to edit. So I can change the name, add a description. I can change the frequency for it to monthly. And if it's due to expire, and it will prompt you 30 days before it's due to finish, it will prompt you to renew if you want to. I can extend it as well. Okay, which I won't do that. And then again, make any changes, save changes here. So that's the search alert. Obviously, there's the potential for publication alert as well, I mentioned earlier. So I click new search here and go to browse by and go to publications. It takes this page. So if I did again, looked for psychology today, I know there's some questions, so I'll try and get to them before I finish. Then I've got this journal. I click on the journal link, go to the tools menu, and you see create the alert, and I can be alerted to new content for this journal, Psychology Today, when those appear. Okay. And if I prefer, I can be alerted on full text only. It is a full text journal in any case, active full text with no embargo. So again, you'll probably be okay with that, and then create the alert. So that's the journal alert that will inform you or update you by email of new content that have appeared in Psychology Today that are available through this database. So again, to manage that, you go to your alerts folder. You'll now see the journal alert Psychology Today is listed. So again, you could add numerous alerts here. You can also set this up for obviously with their consultation with end users as well, with colleagues, and manage that. And of course, if you want to change anything, you just go to the tools menu, edit the alert, and add a description. Maybe you set up for someone, a colleague, etc., healthcare professional, mental health professional, and then you can again also delete if you need to as well. Go in and delete that. So that's the alert functionality. I'm conscious of the time, so we're a couple minutes away. So what I'm going to do here is just go back to my PowerPoint a minute. Okay, I see a couple of questions there just to refer to. We've gone through a live demonstration. Would you not put the word based in there for family-based therapy line? So I think an example I gave, well, the example that I gave, I was using the truncation option for family-based therapy. So when you put family asterisk therapy, it will search for family therapy or family-based therapy. So truncation is used in that respect to search for alternative expressions. Okay, so that's what I did. Yeah, so normally you would, yes. And you could search for family-based therapy literally as it is in double quotation marks. But again, it gave me the option to search for multiple, family therapy and family-based therapy in the same line, as it were. Okay, also a question from Sophie. How does this, I guess that's AI asked, this work in terms of copyright, the AI system? Okay, so I guess normal conditions would apply for anything that you copy from a journal article or publication. We probably can find more information. So that's a new feature. I will just quickly browse for anything I can find on it, because there probably are questions on that. As it's a new feature, it's only been launched over the last week or so and in stages. So some of you may not have seen this just yet. I think today was another date to actually roll this out. So again, we can provide more information on that as needed. So again, just to recap the search history, we had the PICO element created, of course, the patient population group, which featured, of course, adolescents who had eating disorders. We then looked at cognitive therapy. You can see on the screenshot, and that's a bit small, but it gives you the overview of the search history. And then we compared that with family-based therapy, and also we applied the two filters, which relates to the publication date, the last 10 years, plus also the language, English only as well. So again, as I mentioned, and we saw this online, when you find a very good article, then it's an opportunity for you to explore the terms used in the title, the abstract, subject fields used for future iterations of the search. This one doesn't show you this, but we've got the more like this feature, the recommendations feature, which again could lead to other articles that you want to explore in terms of what would be useful going forward, as it were. And of course, you can link to the full text document itself. And we've seen how with the AI tool, you can now explore that article, ask it questions, get a summary of it as well, all related to the specific document that you're viewing. But in terms of training support, I have included some links there to the quick start guide. We didn't get time to look at the PICO search app directly, but there is information on how that's used, more information on searching wildcards, and also creating and managing alerts in this interface as well. Okay, and of course, I've been updating the EBSCO Healthcare Training Resources portal with new sessions for August. So again, you can check this out, and I will also update the support information to include some of the newer documentation that is now appearing. Obviously, our document support team are working feverishly to make sure that we've got documentation that relates to the changes, the features, the functionality that you've seen over the last couple of weeks, as it were. And of course, EBSCO Connect is still the main portal for documentation, tutorials, updates, and so on, connect.ebsco.com. And since this session is also intended for NHS England specifically, if you have any technical issues, then please raise a ticket via the help desk, the service desk. Again, you see a screenshot of that on screen, and that will help them to collate any, issues that are going on that can then be escalated to EBSCO. So again, rather than contact EBSCO support, our support team directly, please log it with the service desk initially as well. Of course, things may change, and you'll know better than me what the general approaches are, but that's the advice we've been given, that you should go directly to the service desk for support. If anyone's interested in future changes to the platform, then there's the EBSCO roadmap. So that will give you access to the research platform, as well as others that are changing or being updated and released. So again, you can explore that, and it will give you the option to filter to EBSCOhost specifically as the platform. You can also explore the EBSCO Discovery Service in the context of the Knowledge Library Hub too. And then you can specify the release date or a category in terms of what elements are changing, what new features are coming out. So again, this is worth exploring, but a lot has been released over the last month, even the last couple of weeks as well. I will stop here. I know we just passed the half-hour mark. I know we started a little late, but I can pause there if there's any other questions. I know I need to perhaps provide more information regarding copyright and AI, but that document may help toward that as well. Okay, so obviously feel free to comment directly if you need to. There's a QR code on this slide as well, when you have time to scan that to provide additional feedback as needed in relation to this session. But I appreciate you joining today. So appreciate your time, and thanks for waiting, and look forward to seeing you online or meeting in person at some point in the future. Thank you.